Assalamu alaikum, the long clinical consultation day. First scenario, Mr. Adam, 47 years old gentleman, presented with a complaint of cough and short of breath. The heart rate 103, blood pressure 107/60, respiratory rate is 22. Take history and examine the patient. Ready, Dr. Kani?
Yeah. Hello, Mr. Adam. My name is, are you Mr. Adam, 47-year-old?
Hello.
Hello, are you Mr. Adam, 47-year-old?
Yes.
Yeah. Hi, Mr. Adam. My name is Dr. Kani. I'm one of the doctors here today. Yeah. I'll be talking to you and examining you and addressing your concerns. Will that be okay?
Yes, fine.
Yeah. Mr. Adam, I understand you've been having some cough and you've been short of breath lately.
Yes, yes, doctor. I have cough for 1 week.
Mm-hmm.
Now become more severe.
Sorry to hear that. Can you tell me more about this cough? So you said it started a week ago, yeah?
Yes.
How did it all start?
Yeah, it start mild cough, mild fever,
Mm-hmm.
and become more and more productive, and even the fever becomes more feverish.
Sorry to hear that. Okay. So, and all this has been going on for 1 week, yeah?
Yes.
And is the fever there all the time?
Yes. If I took paracetamol, I will be fine.
Mm-hmm. So which one came first, the fever or the cough? Or it came at the same time?
At the same time,
At the same.
but the fever it was mild.
Oh.
Then
And when you measured your temperature, what was the temperature?
38,
Okay.
37.5.
Okay, 38 and 37.5. All right, thanks for letting me know that. And have you had such cough in the past before?
Yes, I have 2 attacks before during this last month,
Say again?
and I have similar like this cough during this month. I have 2 attacks of cough.
Okay, so you've had a cough. So meaning that you've had a cough for for about a month, and then it's getting worse in the past 1 week.
No, I have 2 attacks separate. It not continuing now.
In the past 1 month, yeah?
Yes.
Okay, thanks for letting me know that. Tell me more about the cough. Is it productive? You said it's productive, isn't it?
Yes.
So what color of flame do you bring up, please?
It is white to yellowish like that.
Yellowish, all right, thank you. And any blood any blood when you cough?
No.
No. And with the cough, I mean, what makes it worse?
There is no specific thing to make it worse.
What makes it better?
No, nothing.
Okay. And have you been exposed to any kind of dust or anything, or what did you think
No,
what brought up the cough? Do you
no,
know? Okay, that's fine.
no,
And have you traveled anywhere recently?
no.
Okay, thank you. All right. And then you've been getting short of breath also, you said.
It is mild shortness of breath associated with this cough.
Okay. And how far can you walk? Does it affect you doing your daily activities or?
If I do more activity, I feel the shortness of breath is more,
Yeah.
but otherwise it is mild.
All right. So how far can you walk before you get short of breath?
Sorry?
How far can you walk before you get short of breath?
I can walk long time, not long distance,
All
but
right. That's
it
no,
continues.
okay.
Continues
Does it
suffering from.
all right. Does the cough wake you up at night?
No,
Is the
I'm not
cough
sure.
worse in the early hours of the morning?
No.
Okay. And how many pillows do you sleep with? Have you needed to increase the number of pillows you sleep with?
A normal one pillow.
That's good. Do you wake up trying to catch your breath at night?
No.
Any chest pains?
Yeah, it appeared before 2 days like that, maybe with the excessive coughing.
You have
So
pain.
it started, yeah,
Where is
associated
it?
with my cough.
Where is the
Um,
pain?
in front of my desk,
When you say front, right, left, center?
maybe a center, maybe I feel in on my chest.
Okay. And it's
Yeah.
worse when you cough.
Yes,
Okay.
it's already start with the coughing.
Yeah. All right. Thank you. And what about your breathing? Do you have the pain when you breathe, when you take deep breaths?
No.
All right. Thank you very much. Okay. And is there any other thing that you want to tell me with this? Anything associated with this?
Um, I'm not sure.
Okay. And do you have any rashes?
No rush.
No rash. Okay. And do you have any kind of background illness? Any condition you've
Yes,
been treating lately? Yeah. Can you tell me, please?
yes. Regarding this cough, I have been admitted for the previous cough in the hospital, and they gave me medication, and they said to me it is a bug.
I say what?
And even they said to me it is a bug, and they discharged me in oral antibiotic,
Mm-hmm.
and I become fine. And also I have a disease called rheumatoid arthritis,
Mm-hmm.
maybe for 2 years or more.
Okay. All right. Thank you. Thanks for letting me know that. And what do you take for your rheumatoid arthritis?
I'm receiving methotrexate and steroid.
Okay, methotrexate and steroid. And when you cough, is your breathing noisy? Any wheezes when you cough?
No,
Oh,
no,
thank you. All right. So I mean, so that means you've been on admission twice, and this is going to be the third time you're coming.
yes,
In what duration? 2 months, 6 months, 3 months?
no. In this months,
Okay, thank you very much. All right. Apart from methotrexate and steroids, is there any other medication you take?
no.
Any over the counter?
I during this week I took paracetamol for the
Okay.
fever.
Okay. Any over the counter medication?
No,
Okay, that's good. Any family history?
no,
Okay. And have you been exposed to anybody that is coughing around you?
no.
Any weight loss?
Yes.
Okay. How long have you
Uh,
lost weight?
I'm not sure, but all my clothes now are loose.
Is that intentional?
No,
How long? I mean, in the duration of how long have you lost this weight?
maybe for 6 months or more.
Okay, thank you. Any lumps or bumps anywhere?
No,
No lumps or bumps. Okay. Any weather preferences?
no.
Okay. Did you say you have any heart racing? Do you feel your heart racing?
Yes. Did I have noticed this mainly during this month with the recurrent attacks of the cough.
Of the recurrent. Okay, thank you very much. All right. Apart from that, do you take any over-the-counter medication?
No, you ask
Alle-
me.
you're not allergic to any medication, you said, yeah?
No,
Do you smoke?
no,
Do you drink alcohol?
no,
Do you do any illicit medication? Any illicit drugs?
no.
Okay, and sorry to be, what do you do for a living?
I'm a teacher.
All right, good. And how is
Um,
this? Yeah.
yeah.
And how is this
Uh,
impacting you?
um, I took a lot sick leave for this cough.
Yeah, that must be very difficult for
Yes.
you. I think we'll let the school know that you're going through this, and so that they can give you some time off. Is that okay?
Okay.
Okay, that's fine. Uh, any dizziness?
No,
Any headache?
no.
Any joint pains?
Um, Already I have the joint pain in my hands
Arthritis?
related to my
And
rheumatoid.
is it well controlled?
Um, Sometimes when with this period, I feel it is certain to be tender.
Okay.
Uh,
All right. Okay. And what do you have any problems with your bowels? Your bowel habit, has it changed?
no, it's fine.
Okay. And any frothy urine?
No,
And any change in the quantity of urine?
no.
Okay. Thank you very much. Okay, I'll be examining you and I'll be asking you questions as we go. And you said no change in your bowel habits, isn't it?
No,
Any redness of your eye,
no,
hair loss?
no.
All right, thank you. I like to examine you. I like to have a look at the hands.
Yes. I think it will be in the chat.
Yes, it's shared in the chat box.
Okay, that's fine. And do you have any pain in your hands right now?
A mild pain.
Mild pain. Okay. Okay, I'll just touch quickly, look at it. I can see if you've got some deformities in the hand, swan neck deformity. Okay. Then the next thing I'll do, I'll check for the pulse, same as above, yeah.
Yes.
Then I'll quickly check for pallor, any pallor.
Mild pallor.
Okay. Can you check the mouth? Any cyanosis?
No.
No cyanosis. Okay. And then I'll quickly like to check the trachea. Is trachea central?
Yes.
Okay. I'll quickly check for chest expansion.
Yes. It's fine. But it limited in the left lower zone.
Say again.
Limited in the left lower zone.
Limited in the left lower zone.
Yes.
Okay. The expansion is limited in the left lower zone. That's fine. And then the next thing I like to auscultate. I'll ask you to say 99, 99. Yeah.
Yeah. Yeah.
So
Maybe decreased in the left lower.
left lower zone. Yeah.
Yes.
Left lower zone. Okay. And then I'll auscultate. Sorry, I'll quickly percuss.
Yeah. Decreased percussion maybe dull in the left lower zone.
Okay. Now in the left lower zone. And then I'll now do auscultation.
Yeah. It is a vesicular breathing, but diminished in the left lower zone.
Okay. Diminishing the left or right. What was the percuss? I mean the auscultation. What do we
Decreased.
hear? Any crackles?
Sorry.
Any crackles?
Yes. Yes. There is associated with crackles.
Okay. Just in the left lower zone also, yeah?
Yes. Yeah.
Any wheezes?
No.
No wheezes, yeah? And what kind of
Yes.
crackles? Is it inspiratory or expiratory crackles?
It is inspiratory crackles.
Yeah. So is it did you say inspiratory or expiratory?
In
Inspiratory
inspiratory.
crackles. Okay, so I ask you to cough. Does it change with the cough?
Yes.
Yeah?
Yes.
Okay. It changes with the cough.
2 minutes left.
Yes.
Okay. All right. Do you have, Mr. Adams, do you have any concerns?
What I have and how I can solve this recurrent bug infection.
Um, I think what you have, oh, sorry, I just saw the picture of the leg. All right. What you have is due to it could be due to the rheumatoid arthritis that you have. It's now affecting your lungs. But now you've had some fevers with it. I didn't ask, does it have any fever now?
Yes. Now 38.
38 now. So you might be having some infection going on in your lungs, yeah. And we'll keep you in. I like to admit you and do some investigation, do some blood test for you. and do some, because you said you've been admitted twice before and you're coming in for the third time. So I'll do some blood tests to check if there's any bug. And also, the next thing I'll also like to do is to start you on some antibiotics. We'll take, since you're producing flame, I like to take a sample of the flame to really know what's going on. Yeah.
But this was already done for me for the last admission, and they said to me it will not recur. And now this is the third time.
This is the
So how you can help me to let me away from this recurrent illness?
Yeah, because you're on medications that can affect what we call the immune system. That's what helps fight against infection. It could make you susceptible to other infections, but we'll keep you in to really get to the bottom of it. If anything, we get in touch with the lung doctors to really see what's going on. Yeah,
Okay, time is up.
yeah. Yep.
Examiner questions.
Okay. So summarize your case.
Yeah, I've seen this 47-year-old man known to have rheumatoid arthritis on methotrexate and steroids. Of importance is that he's been having recurrent chest infection. This is going to be his third time in film in a month. He's tachycardic, he's tachypnic, and he also has a fever this time around. Is short of breath. Cough is productive and is short of breath. On examination, he has a rheumatoid signs of rheumatoid arthritis. I could see his swan neck deformity. Also on examination of his lungs, he had reduced. It was pale. Also, and trachea was central. Reduced chest expansion on the left. Reduced percussion note on the left, and he also had inspiratory crackles that changed with the cough. Putting all this together, um, my impression will be that this gentleman has chest infection, probably. Probably my first diagnosis will probably be tuberculosis, because he's been losing weight also. I didn't really ask of night sweats. He's been losing weight also. And then my second diagnosis will be pneumonia. And maybe third diagnosis will be bronchiectasis. Yeah, that's it. Infected bronchiectasis. Anyway, chest infection. Yeah.
So how you can investigate this patient?
Investigation of this patient will start from the bedside. I like to do full set of observations. I'll like to check his blood pressure, check his urine for glucose, protein, and glycosuria. I like to check his saturations. He's a 47-year-old man. I like to maintain his saturations at least above 95, 96. Then I'll do full set of blood culture for this man. I'll do an ABG also, full set of blood culture, full blood count. I'll check baseline kidneys, liver function tests, and clotting. I'll do a CRP for him. I'll check his rheumatoid. I'll do a full and ESR and CRP for him. I'd like to do a sputum AFB also for this gentleman. And a chest X-ray. Importantly, chest X-ray will be done, and maybe later we could do a spirometry, since he's already having reduced chest expansion, to know if when it gets better. I'll do a spirometry to know if he's got restrictive lung function.
Okay.
Yeah.
How you can treat this patient?
Treatment of this patient will start from patient education and counseling, educating him on his condition. Also, it's good he wasn't smoking. So patient education and counseling, and then start him on antibiotics using the trust guidelines. Get in touch with the respiratory team to help in the to help in the treatment or in the management of this patient since he's been having recurrent chest infection. I would have used the ABCD of resuscitation, and I would have done a CURB 65. He's a 47-year-old. He didn't look confused when I saw him. I will check his urea also, and respiratory rate is high, but not as high as 25. So I'll use the trust guideline to treat him, and it will be a side room. I'll put him in the side room since I'm suspecting tuberculosis. Yeah.
Okay. Do you have any plan regarding the anti-rheumatoid management?
The at the minute we'll need to hold is methotrexate since we're going to be treating him actively. I'll get in touch with the rheumatology team also and increase his
Okay.
steroids. Yeah. Mm. Yeah.
It's okay.
Yeah. Sorry.
Yes, that all.
Do you want me to call?
Dr. Kani, there is connection problem from your side, I think.
Oh, really? Can you hear me?
Yes, I hear
Can you?
you.
Oh, sorry. When you were hearing before.
It was interrupted.
Oh, sorry. Sorry about that. Yeah.
Okay, continue, Dr. Said.
So that's all.
Okay, you can comment now.
Regard the history, it was detailed about the symptoms itself and the system involved and the constitutional symptoms and the history and the past medical history. Even she touched the other systemic involvement. Regard the examination, I was waiting to ask since the start about the temperature chart.
Sorry. Sorry, I didn't get
I
that.
was waiting. I was waiting you to ask me since the start about the temperature chart.
Oh, yeah.
Okay, I didn't write in the scenario. Um, After you examine the hands, already I have tenderness in my hand. So there was need to look for the activity of the rheumatoid by the tenderness and the subcutaneous nodule below the elbow. Okay. The other thing, you didn't complete for the abdominal examination for possibility of associated illness, associated finding with rheumatoid arthritis for splenomegaly. There was a splenomegaly.
Yeah, felt this, yeah.
The venous and the skin ulcer, it was offered from Dr. Basim because I was waiting you to look for the leg swelling, and at that time you will see this
Leg ulcer.
leg ulcer.
Okay. All right, thank you. So is it Feltis syndrome? Neutropenia
Yes.
and Feltis syndrome. All right, thank you. That was totally missed. Okay.
Okay.
Yeah.
So regard the management, regard the investigation, yeah, it was in the proper way. But you put blood culture before the sputum culture. Not just to do the sputum for acid bacilli, for all.
CS, yeah, for CS also. Yeah.
Yes. Okay. You will continue in IV antibiotic regard the management after admitting this patient. She needs adjustment for the dose of methotrexate because it may be needed to be increased, not to hold, because this um, more deterioration of the rheumatoid arthritis. The next step, if no improvement, you will consider rituximab as biological management Uh, okay, and it will show good efficiency in restoring neutrophil count. If no response, consider granulocyte clonase stimulator. And also consider steroid, but with caution. The end step, if no response for all, consider splenectomy. If all the above are fail to control the neutropenia.
Yeah, that was interesting. Thank you.
Welcome.
Okay, thank you, Dr. Kani, Dr. Sally.
Yeah.
It was interesting one.
So if that was Felty's, I mean, due to
Yeah.
neutropenia, she's got chest infection. So was that pneumonia that she has then?
Yes, exactly.
Yeah.
At least you mentioned the pneumonia one of the differential,
Yeah.
Yes.
but still, what you miss, the systemic review question,
Exactly. Oh, the
the
system.
abdomen. Yeah.
Well,
Most of,
I asked for any lumps or bumps, but my not
yeah,
notice the lumps or bumps. Yeah, that's fine.
numbs or bumps, or even the tummy distension, tummy
Pain,
discomfort,
yeah,
tummy pain, yes.
yeah.
Sometimes we are underestimating the systemic review,
Mm.
and it can be the case. You can get it, the clue from the systemic review question. Okay, even you didn't ask about feeling sick or throwing up,
Yeah.
tummy pain, tummy distension. But you ask about bowel habits. Sometimes, as I said, it's not enough to ask one question. Missing also examination of the hand, look, feel, move for the
Yeah.
disease activity. So you have to ask and to
But
examine.
I thought since she was in pain, I don't. Maybe I should have taken permission if I could touch
Yeah,
because she was in
yeah,
pain.
but don't say I will not examine because she is in pain.
Yeah, I'll take permission. Can I touch? And if she says yes or no, and if
Yes,
she can't,
exactly.
then I can say, can you maybe button your shirt or pick this pen and write something? Yeah.
Yes.
Yeah.
No
Okay.
excuse.
Yeah.
Not no. The examiner, they will not give you excuse that you didn't examine
Yeah.
because you assume there is pain.
Mm.
Offer the examination. If he said no need, you can skip it. But don't say, oh, she is in pain, I will not examine. No,
Mm.
they will minus you.
Yeah.
Okay? You think the case was clear or not was clear? It's clear at the end.
Yeah.
Neutropenia, Felty syndrome, pneumonia. At least you
Yeah.
mention pneumonia. You can mention also methotrexate and steroid immunosuppression
Yeah.
state as a differential diagnosis. So you can get some marks, although you didn't mention the Felty syndrome. But I guess if you will
Mm.
not mention the Felty, you cannot get a good mark in this scenario.
Yeah.
Yeah, at least you know it now. Rheumatoid arthritis in PACES, it comes either methotrexate induced
Mm-hmm.
or as Felty syndrome.
Mm-hmm.
Or you can say also TB. Yeah, it can be the case, but not necessarily to be TB, unless
Yeah.
you will have night sweat, coughing of blood. So they
Yeah.
will give you clues to say this is a
It's not
TB.
TB. Yeah.
Yeah, not only losing weight.
Yeah.
Okay, be careful about this point. The examination, yes, you did the chest examination, but the abdomen was necessary
Was missed.
and missed, yes, to
Yeah.
do splenomegaly. Investigation, I think you did it in the proper way, but still you have to do the sputum before blood culture, as Dr. Sally said.
Mm-hmm.
Multidisciplinary team counseling, education. Yeah, I think you did the clinical judgment well, apart from the management of the case itself. Felty syndrome, as long as you didn't catch it, so
Yeah.
they might minus you in some skills as linked skills.
Mm-hmm.
Because you will, if you will not mention Felty, you
Yeah.
will not say the investigation well. For
Yeah.
neutropenia, you will not do the splenectomy as a management plan.
Yeah.
You will not do the abdominal examination. Also, it will be marked down in the physical examination
Yeah.
and the differential diagnosis. So all skills might be
Mm-hmm.
affected because of that.
Mm.
Anyway, it's a case of learning.
Yeah, I think I was running out of time also.
Yeah.
Mm.
You consume a lot of time in the
In
analysis of the
yeah,
complaint, short
yes,
of breath and cough.
yeah,
And in fact, 2 minutes is enough. The
mm,
nature of the cough, what
yeah,
increase, what decrease, the
yeah,
color,
yeah,
productive or dry, short of breath, what increase, what decrease. Two
yeah,
minutes, maximum
mm,
3 minutes. I think you spend 5 minutes asking for the analysis of the complaint.
mm.
That's why you didn't have the time for
Thank you.
systemic review. You
Yeah,
didn't have the time to do abdominal examination as well.
yeah.
Okay. It's a repeated case, by the way. Felty syndrome, it comes in exam in frequent manner.
Mm-hmm.
So
That's
yeah,
good.
you have to get ready. Yeah. Rheumatoid
Yeah.
arthritis,
Mm-hmm.
either mesothelioma induced
Yeah,
fibrosis and so on,
yeah.
or as Felty syndrome and pneumonia and also recurrent infection, sore throat or whatever the infection. Okay. Do you have any
Thank you.
question?
No, thank you.
Dr. Sally, any comment?
No, it's fine.
Travel history. Let's see the comments. Travel history. I think she asked earlier. Travel history. She
Yeah,
asked. Yeah, she
yeah,
asked.
sure.
Lymph node examination, of course, high resolution CTHS investigation, infection control team management. Yeah, all these supposed to be mentioned. Dr. Ibu, her patient said when Dr. Kani said she missed it, Miss Melania missed it too. Dr. Kani knows it completely. Should we ask about travel history? Yes, it's a mandatory. For any infection, you have to ask for travel. Travel history, either it will be a clue for endemic disease, as
Yeah,
TB, for example,
yeah. Ask that.
or sometimes you can catch infection related to the AC,
Mm-hmm.
chlamydia, and atypical pneumonia, for example.
Mm-hmm.
So the travel
Legionella.
is a must
Yeah,
to ask about it.
yeah,
Okay?
yeah.
I think, Dr. Basim,
Yes,
this is a
doctor.
problem of spot diagnosis. If you found a spot diagnosis, don't think it will be an easy case because they will expect from
Yeah,
you you will cover everything. You know now.
yeah.
But for me, what you did is fine. But I think you took a long time in the history. Then you
Mm,
found you are under the pressure of time. So you
yeah.
did not finish in the history. You ask about the weight loss, but you did not ask about the sweating or the contact with tuberculosis patient or patient with chronic cough. And
And
also since
I asked
no.
about cough.
Yeah, but you did not ask about the contact with tuberculosis patient to exclude it
Mm,
from the start. And
mm,
during the history, when you explain the concern, when you address the concern, you explain the diagnosis as pneumonia. But when
yeah.
you came to the examiner, you put your tuberculosis number one. I don't know why any. If you remember when you contact back to the patient,
Mm-hmm,
you said you
mm-hmm.
have chest infection,
Yeah,
just like you put at that time your pneumonia at the first differential diagnosis. But
yeah.
maybe later on when you rely and you remember the weight loss,
Loss. Yeah.
you change. Although in the history you did not finish that one, and also you did not finish the rheumatoid arthritis. But I think what you did, yes, you missed the felty, but what you
Yeah.
did is fine because I think if you took less time in history, you
Mm-hmm.
will master it. Because at the end, the seven criteria, even if you master the history, we said this sentence a lot of time. Even if you master the history in and out, you will get only 4 marks.
Mm.
So the others skills also every skills it will you will assess as a formal. So yani if you took 7 minutes in history, even if you did not finish the history, you will not get zero. Either you will get pass or borderline. So it is
Yeah.
okay for you. You get this, and instead you will miss the major
System.
things.
Yeah.
So you will make a balance. But go on, you are doing great. And I saw you many times. Mashallah, you are doing great. Just keep on.
Thank you.
Yeah, thank you, Dr. Mahjoub. I agree with you. So she has to manage her time perfect next time to be much improving in this skill. Okay. By this way, she can get a lot of time to examine, a lot of time to specify question for the systemic review, and so on. Sorry. Sorry, there is open mics. Maybe Dr. Henry.
Because simply in spot diagnosis, you don't need خلاص from the start, you know, from the start, from the
Yes,
second 30, you know, this is rheumatoid arthritis. So what
exactly.
you need more time on
Complications,
examination and complications. Yes,
complications, yeah.
exactly.
Complications.
Complication, examination, and
Yes, yeah,
communications.
yeah,
So you don't need to dig more and more in
exactly.
history because
Yeah.
from the first minute you will know this is a rheumatoid arthritis patient.
Yes, yes. Complications. Thank you.
Yeah, thank you, Dr. Mahjoub again. The second scenario for Dr. Sally, please. Take history from 28 years old lady, comes with palpitation. Heart rate 102, blood pressure 160 over 95, respiratory rate 18, saturation 98 on air, temperature 36.5. 2 minutes, Dr. Sally, then we'll start.
Okay.
Dr. Ahad asked good question. How would you put the differential orders here? Before that,
Mhm.
she commented that well done, just try to decrease history taking time and the symptoms analysis, as colleague mentioned exactly. So let's go to the differential. Filty syndrome, of course, and neutropenia in the top of your differential. Then we can mention immunosuppression because of methotrexate and steroid. And again, also the patient might have recurrent pneumonia. And the third, you can put, as Dr. Kani mentioned, the TB, pneumonia, or pneumonia for any cause. I think these are the differential. Can we put the differential as methotrexate-induced fibrosis? Do you think?
No.
Why not?
Um, what she described was more of like a bronchiectasis to me. It's something wet. When it changed with the cough, the
Yeah,
crackles changed with the cough.
yeah, perfect. Okay, but we are talking about the complaint itself, short of breath and cough.
Sort
So
of breath and cough.
yeah, so and both of them can present with the induced fibrosis of methotrexate or
Yes.
methotrexate. So
Yeah.
still you can put it, but you can say again is that the cough is productive
Yeah.
and the crackles doesn't change, or does it change with the cough?
So this diagnosis, will it be maybe unresolving pneumonia secondary to
Yes,
sec
immunosuppression
yeah, secondary to immunosuppression. Yeah.
and Felty syndrome. So these are the two differential, the most sensible two differential, and you can add if there is history of travel or contact with sick patient, you can say, as you mentioned, the TB.
Maybe, yeah.
Tuberculosis
Okay.
also is valid, as you said, Dr. Basim. Although the pathology in lower zone, but usually in the
Upper zone.
immunocompetent patient, they will be in the upper zone.
Upper
But in
zone.
such patient on immunosuppression,
Yeah.
anything you can expect. You can expect the pathology in middle zone, lower zone, upper
Yeah.
zone,
Yeah.
anything. It will be atypical.
Yeah.
Yeah, perfect. So the zone will be also different in all cases. What was the rash diagnosis, Dr. Sally?
Um, it is also associated with Felty syndrome.
Is it specific or just immunosuppression? Because of the
آه
immunosuppression.
صراحة كنت قريت عنها لكن نسيت
Okay, yeah, you can share it
it
again.
looks like يعني أيوة حشيرة تاني.
Anyway, if you find it, you can share it again. Okay.
Okay.
Bronchiolitis obliterans as a complication of rheumatoid arthritis.
No, there was no wheeze.
Yeah, perfect. So this is the clue. Will be wheeze chest, and also cough will be there,
Yeah.
right? Okay, good discussion. Thank you, everyone.
Yeah, thank you. That was very good. Thank you. And I'm
Yes,
glad I did this station. Thank you.
Can I
Dr.
say
Sachs.
something? Hello. Just,
Yeah,
thank you,
sure.
Dr. Kani. Just I wanted to have a very, very short comment. Just make sure that you don't overtalk through patient, because what we all are in stress and rush to ask questions and take the history from the patient, but we should be very cautious not to overtalk the patient, because sometimes if patient is slow and trying to answer your questions, but you just try to rush to another question, and then you will overtalk to the patient, which will not be, the examiner might down mark for welfare, patient welfare. And also patient ask that why do I have these infections frequently, then we can explain that, okay, you are taking some medications that your defense system is weakened, so you are prone to infection, something like that, to address patient concern. And also you didn't examine the lymph nodes.
Yeah,
Yeah.
Yeah,
but I
perfect.
think I told the patient that it's due to the
Yeah, do have
medication just
lungs
taking.
transforms. Yeah, but yeah, I agree. But sometimes, what happened to my exam? I mean, sometimes for some examiners are so sensitive that they won't put any room for any mistakes. And for example, if we miss a very small point in examination, they will mark you as even unsatisfactory, unfortunately, which is not fair, but can happen. That's why in a recurring infection, we should examine the lymph nodes. And also,
Mhm.
I think we should mention about HRCT, because if the signs are consistent with the recurrent infections, we should do HRCT too, because I was not clear for the examination points. If it is a parapneumonic infusion, it's a consolidation, or is it just a pneumonia or something like that. So I think HRCT will be very helpful also.
Yes, I agree with you, Dr. Farvi. As I mentioned, always, if you put your investigation in organized way, you will not forget any of them. In order to mention, so you can say general, specific, bedside, imaging, and invasive. And here also you might have invasive investigation. What do you think the invasive investigation will be here, Dr. Kani?
Well, bronchoalveolar
Yes,
lavage.
perfect. Bronchoscopy. So the examiner will be impressed whenever you make it in the stepwise as investigation in this way.
Mhm.
1, 2, 3, 4, 5. General,
Mhm.
specific, bedside, imaging, and
Mhm.
invasive. And he will ask you, give me, what do you mean by specific? What do you mean by imaging?
Mhm.
And now you can mention the high resolution CT chest. You can mention the bedside test in the form of spirometry, for example, pulse oximetry, okay, urine dip, and for a specific, you can say sputum culture and
Mhm.
ABG as well. But one of the bedside tests
Mhm.
supposed to,
Mhm.
to do ABG. So I believe you have to be in this way in the management plan as investigation. Don't say just I will do 1, 2, 3 without putting highlights or
Mhm.
headlines. You have to highlight on the headlines. Then
Mhm.
you can give example, or he will ask you, doctor, what do you mean by that? What do you mean by this? You can give him example, but he will know that you are organized one rather than mentioning everything. Okay.
Mhm. Mhm.
Okay. Thank you, Dr. Farvid and Dr. Kali. Let's start the second scenario. Dr. Sally, you ready?
Can I know the name of the patient?
Melanie.
Melanie.
Yeah.
Ready?
Yes.
Where you go?
Hello, I'm Dr. Abdalal, one of the duty doctor here today. You are Miss Melanie, who is 28 years old.
Yes.
It is okay to discuss with you about your condition and to examine you.
Yes, please.
It comes to my knowledge that you have awareness of your heart racing. Can you tell me more about this?
Yes, doctor. I've been having this feeling my heartbeat recently for the past 4 weeks. It started, but these days, in the past 1 week, it's been so horrible. I can feel it, as if it's going into my ears. Pum 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 pum, very, very, I can hear it. Yeah.
Sorry for your complaint.
Thank you.
Is it start suddenly or gradually?
I noticed it about 6 weeks ago. I could feel the heartbeats, and then I wasn't sure, and it's just been increasing gradually. So in the past 1 week, it's just too much.
Okay. So did you seek medical advice during this time?
No, doctor, that's why I've come in today.
Okay. So can I know all the day you have this heart rating or a specific time?
It doesn't have a particular time. I can be lying down, I'll feel it. It comes anytime.
Okay. It comes and goes or continuous?
Yeah, it comes and goes. Not that, yeah, it comes and goes.
Do you notice anything increase that heart racing?
No, no, doctor, I haven't.
For example, activity or any stress?
No, doctor, not really, no.
Okay. You feel this even during sleep?
Say again?
Even during sleep, you feel
Um, well,
still?
when I sleep. But when I wake up at
Okay.
times I can feel it.
Okay. So uh, do you have any other complaint associated with this problem?
Mm, doctor, I don't know. Like what, doctor?
Okay. Any chest pain?
No, doctor.
Any shortness of breath?
Not really. Well, just a little bit these days. Yeah, not too much. Yeah,
Shortness of breath.
not really. Doesn't really affect me. No, I'll say no.
Okay. So any cough?
No cough, doctor.
Okay. So any leg swelling?
No, not that I've noticed, doctor.
Okay. Any change in your weight?
No, I've remained the same. No,
Okay. Any change in your appetite?
no, I eat very well, doctor. I'm
Okay.
eating the same.
Any okay. Any high body temperature?
High body, like a fever?
Yeah.
No, doctor.
Okay. Any intolerance to the weather?
What do you mean?
Intolerance to the weather. You can't tolerate the cold or hot weather.
No, 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 no. I'm no. The weather is lovely now, and
Y-
I'm fine with it. No.
Okay. Any sweating
Saying that, I think yeah, I've been sweating a bit these days. Yeah.
during this time, 6 weeks or more before this time?
I think I noticed the sweating maybe about 2 months ago, and I thought it was the warm weather, but I've been sweating more these days. Yeah.
Is it continuous since that time?
Yeah, for about 2 months, I've noticed I'm sweating more. Yeah,
Okay.
but I don't know if it's
So,
because of the weather.
okay. Any shaking of your hands?
No, doctor.
Okay. Any change in your skin color?
Changing my skin color. No, doctor.
Okay. Uh, can I know regard the palpitation and the sweating? Do you feel they are associated in the same time?
Do I feel what?
They are associated in the same time when
Wait.
when you are feeling more awareness of your heart rating, more sweating.
Oh no, the sweating, the weather
I mean,
is.
if they come in attach.
Oh no, 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 no! I just sweat. I think the weather is warm, so I'm sweating more. This is not associated. It's not that when I start having the palpitation, that's when I sweat. No, I just sweat.
Okay. Any
Yeah.
hunger pain?
Ankle pain, no, doctor.
Okay. So any headache?
So talking about that, I do have just a bit of headache once in a while.
For how long?
No, no, it's not much. Not much. Just it comes and goes.
Okay.
Mm,
Any change of vision?
no, doctor.
Okay. Any change in your hand size
No, doctor.
or shoe size?
No, doctor.
Okay. Any skin rash?
No, that I've noticed. No, doctor.
Okay. Any skin rash to sun exposed area?
No, doctor.
Any joint pain?
No joint pain, doctor.
Any back pain?
No, doctor.
Okay. What about your bowel motion?
My bowel motion, I think it's okay, doctor. It's normal.
Okay.
Yeah.
Okay. Any change in your water function?
No, doctor.
Any mouth sore?
Mouth sore. No, doctor.
Any soreness in your private area? Sorry for
No,
asking
doctor.
this question.
No, doctor.
Okay. So can I know if you have any background of medical illness?
Um, Background. Doctor, I think I had my thyroid removed last year.
Okay.
Yeah.
So okay. Can I know why they removed your thyroid?
My thyroid, I mean, you could see my neck was swollen, so the doctors removed my thyroid.
Okay. So if there was any associated other gland in your body,
Again?
any associated other disease of gland in your body?
No, doctor, that's the only thing. This I've been always been okay until I
Mm,
noticed that swelling 2 years ago, and then they checked, and
okay.
then last year they took out the swelling, and now I'm fine. You
Okay.
can see the scar.
Okay. They remove this gland because it is active. It makes some symptoms on you, or because you didn't like the lump in your neck.
It was a lump in my neck, but they said it was okay. I think they did that test. What do you call it? I think you call it. Is it TSH? Isn't it? And they said it was fine, but it was just the gland was swollen.
Okay. So after they remove this gland, any medication was prescribed for you?
No, doctor.
Okay. So you are regular in follow-up regard your gland with your gland doctor?
Sorry? No, I've
You
not
are
seen
you
them.
are okay. Um, uh, uh, do you have any other background illness apart from this surgery?
No, doctor.
Okay. So do you have any other illness like high blood pressure?
Doctor, I think when I came in, I think last week also I checked my blood pressure. It's a bit up.
Yes. Apart from that, do you been diagnosed with high blood pressure?
No, but I've noticed that you can see, I think this morning when I came in also, your
Oh,
nurse said my blood pressure was high.
okay. So any high blood sugar?
No, doctor.
Okay. Any family history of gland disease, running disease of gland?
Oh, saying that my mom, yeah, my mom had she had the same thyroid problem.
Okay. And how's she?
She's okay. Thank you for asking, doctor.
I mean, regard her thyroid
Yeah, she's fine.
problem,
Thank you. Yeah, thank you, doctor. She's fine.
okay. Any history of diabetes or skin rash in the body?
No, no, doctor.
Okay. So can I know your medication list?
Yes, I take thyroxine. Yeah,
Okay.
and I take thyroxine, and I just take some paracetamol once in a while when I have headache. That's all.
Okay. Regard thyroxine, you are regularly taking this thyroxine.
Yes, yes, doctor. And they check
Is
my
it
yeah. I think the last
okay?
time I had a checkup with my GP said
Okay.
everything was fine.
Okay. You are taking the same dose since
Yes,
was
doctor.
prescribed.
Yes, doctor.
Uh, okay. So can I know if you have any other medication you are taking and you stop?
No, doctor.
Okay. Can I know what about your mood?
My what?
Mood.
My mood. I think I'm okay. It's just this palpitation is
Okay.
just, I'm okay. My mood is all right.
Okay. It's okay. Any herbal use?
Any what?
Any herbal medication?
No, doctor. I don't do that.
Okay. So did you smoke,
No,
Miss
I don't smoke,
Milani?
doctor. No, doctor, I
Did you
don't
consume
smoke.
alcohol?
No, doctor, I don't.
Okay. Can I know what is your job?
I'm a housewife, doctor.
Okay. Sorry for asking more question. Do you have any attacks of loss of consciousness or
No, doctor.
syncope?
No, doctor.
Okay.
Thank you.
Okay. Thank you. So okay. What about your period, Miss Milani?
My period,
Is
my
it regular?
period. Yeah, my period is fine. It's regular. Thank you.
Okay. Sorry for asking private question. Do you have a partner?
Yes,
Okay.
my
Um,
husband.
okay. Do you have a kids?
Yes, I've got kids, doctor. I've got
So
3
there is a
kids.
possibility to be pregnant.
Well, I don't. Say again? No, I'm not pregnant, doctor. No.
Okay. Can I know what is the last period for you?
My 5 days ago.
Okay. So okay.
Hmm.
Okay. So can I examine you?
Yes, doctor, you can.
Okay. I will start with the general look of the patient.
Yeah,
Okay. Then
yeah,
I will start for your hands.
yeah,
Can you stretch your hands for me?
yeah. Fine. No tremors,
Okay.
nothing. Yeah,
I will look to that sweating of the hands. I will check for the pulse for the regularity of the pulse. I want to
yeah.
be assess the regularity of the pulse.
Tachycardic.
Okay. I want to check the blood pressure supine and standing.
No postural drop.
Okay. I will check for proximal myopathy.
Proximal myopathy. No,
Okay.
nothing.
I I will look to the eyes for pallor or jaundice.
No pallor. No jaundice.
Any change in the eye regard little bit retraction exophthalmos.
No, doctor.
Any
No,
okay.
doctor.
2 minutes left.
Uh, okay. So I will see your neck. Can I see your neck?
Yes, you can see that there will be a scar. No bumps, nothing
Okay.
else.
Any tenderness in your neck?
Any what?
Tenderness.
No, no, no tenderness. It's clean. The scar is clean. Nothing,
It
no
is
bumps, nothing.
okay. I will
Yeah,
ask you to take a sip of water to swallow for me. I observe you.
nothing. It's okay.
Any noticeable gland
No
swelling?
gland, nothing, no gland.
Okay, I will look for the lymph nodes for the cervical, submandibular,
No,
supraclavicular lymph nodes.
no lymph nodes.
I will auscultate for the suprasternal for any. I will percuss in the suprasternal area.
Yeah, nothing.
Okay,
No
I will auscultate
retrosternal goiter. Yeah.
for any point. So I will auscultate for the heart, for the apex,
Yeah.
any murmur.
No more tachycardia. Regular.
What about the sound? Okay,
Normal heart sounds
so
1 and 2.
okay, I will go to the leg for any leg swelling.
No leg swelling.
Okay, so I will check the blood sugar.
Yeah.
Um, what about?
Blood sugar is okay.
Okay, so can I know what is your question, Miss Milani?
Yeah, doctor. I mean, this my heart beats. It's very. I don't like it. It's really, really worrying. So I just
Okay,
want to know why
yeah,
am I having this, doctor?
yeah. There is a lot, some possibilities. First could be related to your thyroxine. May give you these symptoms.
Yeah,
The other possibility, maybe your gland it regrows again
yeah,
and it becomes active. but now it's not palpable for me, so I need to do some tests to reassure about the exact cause. Is it related to that medication or to the gland itself?
Okay.
Do you have any other concern?
Um, okay, doctor, so how are you going to help me?
I will keep you here in the hospital till we do the investigation.
Mhm.
I will do ECG, bedside ECG,
Okay,
to
doctor.
reassure this cause of
That's okay,
palpitation. Is
doctor. I
it
just
related to
wanted
the
to.
heart?
Sorry, doctor.
Okay.
Cause my mom had this thyroid, and I have it. Do you think my children will have it also?
This type of disease could be a running disease in the family, but it not inherited. There is a possibility to your kids to have same uh, thyroid problem or any other gland problem.
Yeah.
Do you have any other
Yeah.
concern?
Oh, there's possibility.
Yes.
Oh God, I don't want my children to go
But
through this.
yes, but before that, I want to reassure with the blood test about the type. If sometimes there is a defense a system of your defense system, there is a fighter for the gland. If it is related to that defense system, yeah, there is a possibility to be running in the family. And if it is separate from your mom disease, could be. Uh, not direct cause for the to be running in the family.
Okay.
Do you have
Okay.
another concern
No, I
in
just
the
don't
same
want my
family?
children to have all these things. That's all.
Yes, I will reassure and I will update you about this point. Let
Okay.
me first to complete the
Okay,
workup about you.
Thank you, doctor. Thank you very much, doctor.
2 minutes extra I give to you for the consent,
Yes.
but
Yes.
let's go to the examiner questions.
Yeah. Yeah, doctor. Can you tell me what your diagnosis from the history and your findings? What?
Okay, so 28 years old female presented with a complaint of palpitation for 6 weeks, around 4 to 6 weeks. Um, uh, she has a past history of thyroidectomy and followed by thyroxine.
Yeah.
Um, she has no atypical feature of thyrotoxicosis
Yeah.
in the form of tremor or thyroid enlargement or any
Yeah.
associated.
Yeah.
She's not using any illicit drug for her palpitation.
Mhm.
She's not pregnant and she is worried about her inheritance of the disease in the family.
Yeah.
Okay.
So, what's your diagnosis, doctor?
Um, uh, First, I will put thyroxine
Yeah.
related effect.
Mm.
Other recurrence of the thyroid hyperactivity, hyperthyroidism.
Uh-huh.
Uh, okay.
Okay. How will you investigate this patient?
I start with routine investigation, complete blood count, liver function test, renal function test,
Yeah.
ESR, CRP. I will do thyroid function test and thyroid antibody test, anti-thyroglobulin and anti-thyroid peroxidase. I will do radioiodine, thyroid iodine uptake scan for thyroid. I will do ECG as baseline and as bedside test. I
Oh,
will do also echo for reassurance about her heart, the effect of the thyroid in her heart. Um, uh,
hold on. Okay. And how will you manage the patient, please?
First, I will start by patient education and counseling about her situation. Um, uh, um, she may need uh, multidisciplinary team if it is autoimmune.
Yeah.
Uh, And then if it is according to the cause, if it is a recurrence of the hyper of the gland itself, it need to be assessed and to be treated and to stop the thyroxine. And if related to the drug itself, to manage if she need low dose or no need for the medication for a while, till to be reassessed by the endocrinologist.
Okay. Thank you very much, doctor. You did very well.
Still,
You
Dr. Khan, still 2 minutes.
still 2 minutes. Okay. Oh, go on.
Yeah, give her more
Well,
questions.
more questions. Okay.
Quiz her.
Now, when you the mother of this. Okay, I should ask you more questions. Um, so how did you say you're going to manage the thyroxine? Yeah, you said you do
How to
thyroxine
manage?
tests. Yeah,
Sorry.
what did you say you're going to do? You're going to do the goit. You're going to do scans and everything. Yeah.
Yes.
Okay. Doctor. Is there any other association that you can think in this condition?
I'm thinking in
how are you going to manage this patient's high blood pressure?
um, mm,
The blood pressure is high. She's
yes,
28.
yes,
How are you going to investigate her blood pressure? Why is she having high blood pressure at 28?
yes, you're
And
right.
how are you going to
Uh,
treat her blood pressure?
okay, I was thinking in pheochromocytoma as a start, but with the symptoms it didn't show. So I forget about the blood pressure in this point. I
Mm.
will uh, I will do adrenal ultrasound and adrenal CT.
Yes.
I will do fraction plasma for fraction metanephrine.
Uh-huh.
Uh, uh, Also, I will put in my mind for men one as associated NS, and also it is inherited. So I will reassess the patient about the other. So I will come back to the investigation to do parathyroid hormone, serum calcium. Uh,
So you said this patient has few chromosomes. You think she has few chromocytoma. How will you
there
treat?
was, but
What
not
what
typical picture. So I will think in the adrenal adenoma as a possibility rather than pheochromocytoma.
why?
Uh, because thyroid is more in multiple
The thyroid has been
neoplasia type 1.
okay. Tell me the treatment of pheochromocytoma in this patient. How are you going to treat her blood pressure?
Yeah, I will start with the final treatment for pheochromocytoma is surgical. So I will prepare for this
Yeah.
state by give her alpha blocker and then beta blocker and then
Okay.
to
Good.
remove. But
Okay.
before
So
that, I will put in my mind, is there any other associated gland abnormality? Is it isolated pheochromocytoma or
what can
multi-inguinal?
you tell me what is men one?
The main one, it related mainly for hyperparathyroidism and parathyroid enlargement with adrenal adenoma and pituitary adenoma and gastronoma or pancreatic associated adenoma
It
with
is
some skin angiofibroma, skin rash in the face.
okay. And men two?
Mento, it is a medullary thyroid carcinoma
Mhm.
with pheochromocytoma and hyperparathyroidism.
So which one do you think this patient has in this case?
If I would took the chance, I will took the chance for type 1 because thyroid is rare in type 2.
No, I think you've missed. Okay, we'll talk about it later. Okay. And
So I
what is
recommend
going to be the what test will you do for this patient if you
genetic,
think
yeah, genetic
okay,
testing.
In men
to be
one,
assured.
what genetic are you checking?
Uh, I think I forget the name.
Okay. And in men two?
It is red one.
Yeah, well
RED.
done. Well done. Dr. Basim, I think I've squeezed that enough. That's okay.
Yeah, that's enough. Okay. You can comment now.
Thanks.
But you see,
Well,
the extra questions
yeah,
showed her what she is missing and what she is
yes,
defective.
yes, yeah.
Okay, so she
And
can focus on this part later. She
yeah,
can read about men, and because all what she mentioned was wrong. Dr.
yeah.
Sally, take care.
You did very well in your history. You asked LOC, chest pain. I don't know if you asked dizziness. I don't think you did that. You asked everything, checking for acromegaly, checking for other things. But I don't know if you asked me about caffeine.
Cough, yeah, I asked.
You asked about caffeine, okay. Yeah. Because
Cough,
when
yes.
caffeine or the
Caffeine, not coughing. Caffeine.
caffeine, yeah.
Uh,
If I take a lot of coffee, did you ask me if I take a lot of coffee? If I take
no,
salbutamol, I mean, I would have told you in the history, but coffee and illicit drugs is very important. When you see a young patient, always think of very bad
yeah,
attitude. So the young people coming with certain things, think of bad habits that they could have. So caffeine is important in this
yes, yeah,
palpitation. Yeah, salbutamol, theophylline, any other illicit drugs and so on. You asked everything. I don't know. Did you ask of travel history?
yes, I asked.
All right, that's fine. I think your history was fantastic. The thyroid has been taken out, so I don't know why you kept checking for thyroid again. And when I gave you the history of my mother, so I gave you the history of my mother having that was trying to make you know that. And then when I asked for consent, I wanted to draw you back, and I said, don't talk about investigations. Will my daughter have it? Just to draw you back that it's an hereditary thing. So she's a young lady, she's had thyroidectomy, and she's coming with sweating and palpitation. So it's pheochromocytoma, as you said, and it's meant to.
Okay.
Yeah.
So I asked you during the history that if the doctor told you that you need any gland removal,
Any what?
already
Yeah.
I asked you in the history if your doctor told you that is there any need to remove any other gland in your body, you say no.
I said
I
no because
think
they've removed my thyroid, and now I have
yes,
pheochromocytoma, which you are going to now
yes, but
diagnose.
it is sure it will be medullary thyroid carcinoma. So
Yeah, that's what they took out.
and should be the doctor aware that he will check for other associated carcinogenic gland.
Yeah.
Uh,
This is a case.
so
This
the
is a
history,
PACES case. This is a PACES case. This was my case. This was my case. Is a PACES case. So
and even
thyroid.
the pheochromocytoma, I'm asked for the flushing, for the hunger pain, for this.
I
Even I
told you
asked
about.
you
I told you
about the
about sweating.
association
I
of
told you
the
about
palpitation.
sweating. I told you about sweating. I told you about high blood pressure. I told you about headache. That is not
Yeah,
not so much.
I was looking for the flushing time. I asked about the association of the palpitation with the sweating at the same time to look for the pheochromocytoma. Already when I enter as pheochromocytoma, but uh, there was some misleading uh, point. It led me to be away, and I took
Mhm.
as isolated thyroid gland.
Yeah, but the thyroid was already off. Sorry if that was misleading. I'm sorry. But the thyroid was already taken out. This was my case, and it's exactly what I was told that I'm saying to you. This was my case. What led me to feel it was pheochromocytoma was cause of the mother. When she told me the mother also had thyroid problems. So I said, you just link the two. Sorry if maybe I didn't give you very good history. I'm sorry about that. But I thought maybe when you checked from outside, there was high blood pressure, palpitation, and you came in. I told you about sweating. I thought that and some headache. I thought I would have just quickly linked it and the family history. But sorry if that was misleading.
Okay, it's fine. I will not
Yeah,
forget this
yeah, you
point.
won't. You won't. Well done. Apart from
Yeah,
that,
thank you.
you did very well. Well done.
Thank you.
Yeah.
Okay. Thank you, Dr. Kani and Dr. Sally. I think she did well, but the most important point here is the fluency of the questions. She is calm,
Yeah.
extra. I mean, she's too calm, not only calm, need to be in hurry. Dr. Sally, in the exam, you will not have the time to be in this slow manner. You have to hurry up the
Okay.
questions to be more fast. Do you smoke? Do you drink alcohol? And to hurry up more in the examination because you didn't finish the examination. You missed the concerns. I add 2 minutes
Yes.
for the concern. So you have to be more fast in the questions and to be
Okay.
to the point question. You have headache. You have, as Dr. Kani said, you have headache. You have tremors wasn't there, right? Headache and palpitation and sweating. It's equal for to fuchromocytoma. In the examination, I think you ask for the tremor, which is good point. You have good knowledge, by the way, but the fluency should be more fast than this. You have to be more faster than this. In the exam, you don't have the time. But by the way, if the surrogate is helpful, you might also have defect in the time. Imagine if the surrogate is distracting you and also he's giving you wrong information, deviating you from the track. He's not answering
Yes.
properly and fast. You'll be more in trouble. So you have to be
Yes.
more fast, okay? Just try to train yourself how to ask the question quickly and to the point, okay?
Okay.
The approach you
Okay.
have is good, but still need to manage the time. And it will be
Okay.
improved with the practice. Okay,
Okay.
let's go to the knowledge and the clinical judgment. You said min 1. What do you think about min 1 in this case? Is it correct? Because it's a fatal mistake, and I guess Dr. Mahjoub also was wondering why you are saying min 1 in this patient.
The thyroid.
Thyroid is not at
She's
all
taking
in type 1.
thyroid.
No thyroid in min 1 at all.
No, there is thyroid in men.
No, parathyroid.
Yes,
And
parathyroid.
one
Oh,
is three
what?
P's, isn't it? Three
Yeah,
P's,
three
two
P's,
P's, three
parathyroid,
P's, two
pituitary,
P's, and one
pancreas.
P. Yeah, I forgot to.
Yeah, be careful. It's a fatal mistake. If you mention min 1 here, the examiner may be irritated. No thyroid at all in min 1. Okay? Dr. Sally.
Yeah, I'm hearing you.
Okay?
Yes,
Thyroid and
I'm just
medullary
looking
thyroid
for.
carcinoma in type 2, min 2.
Okay.
Okay? And fuchromocytoma, yes, you might have it in type 2. But again, parathyroid, pituitary, pancreas in min 1. So be careful about that. Once you mention it, I was wondering what you are saying. Okay? And I think this is
Okay.
the extra question Dr. Kani ask you. Now you will not forget again the min
Yes.
1. Okay?
Yes.
So
Yes.
revise it or revise them, min 1 and min 2. And also there is 2A and 2B. And you will know every type. But for the thyroid, it's in present in type 2. Okay? What
Okay.
about the genes? Min 1, what the gene?
Uh,
And min
it
2,
is
what the gene?
I know red one, red two for two, and I'm not sure about the gene for the name of the gene of Minwen.
Many, many.
Sorry?
For Minwen, I'm not sure about the name of the gene for Minwen.
The red.
Uh-huh.
Where
Red,
is the red?
Red for
The red
red
gene.
red for
oncogene is
two.
in men too.
Red in the gene
Red for men too.
in min 2, right?
Red
Yes.
Men one,
oncogene is
men
in
one
men.
gene.
Yeah, min
Men
1, min
two
1
is
gene.
red
And
on
min 2,
Men
red.
is men. Men one is the
is
same. The
men.
Yes.
gene men one gene. The men
Yes.
And
two are right
Red
oncogene.
yeah, red.
oncogene, yes.
Yeah.
Yeah.
Okay.
Okay.
I
Okay,
have
anyone?
shared you.
Yes.
Okay. I have showed
Sorry?
you some photo in your WhatsApp.
Yeah, I can see now thyroid adenoma in men 1.
No.
From where this photo?
Yeah,
This is what I know. I don't know.
men 1 is pituitary, parathyroid, and
Yes.
pancreas. And any other little ones associated, you can have vipoma, gastrinoma with men 1. Men 2 is medullary.
This is what I know also, Dr. Kani, but
I
she
very
shared me.
assure.
She shared me this photo. I will share it. I don't know
Okay.
what the
Where is that from?
source. I don't know.
As a source, I don't know from where. I just in the study group they
No.
sent about this.
Thyroid adenoma 55% in men 1.
Thyroid adenoma. No. It's 3 P's. Only, I don't know.
Yeah, this is what I know also.
3
I don't
P's,
know.
2 P's, and 1 P. Men 2, parathyroid and pheochromocytoma. And then and then the other 1 P is just pheochromocytoma and mafanoid status. And
Yes.
mafanoid habitus. And then I think it's in that men 2 one that you can have the mucosal neuroma that you were talking about. In 2B, you can have mucosal neuroma and all those things.
Dr. Sal, in the same pictures you shared, check what about the medullary thyroid
Carcinoma.
carcinoma. The same photo you send in. And they are giving you men 1 and men 2 in the same photo.
Yeah, it's
Then
not present. Yeah,
No,
it's
you
not
will
present.
see, you will see. There is the percentage. So it is obvious in the men 2, the fix is medullary thyroid carcinoma plus pheochromocytoma. This
But
is
she's talking
fixed.
about thyroid adenoma, Dr. Mahjoub.
Yeah,
It
yeah.
was written 55%. I don't know. This first time to know that, really. You got it?
Yeah.
even me when I have discussed this scenario. It was mean when, and I took the scenario as it is meant to. Um, at that time, the point was about the thyroid could be associated in men one, and even they gave this high percent of the association.
Mm.
This first time.
To me, I don't know from where you get this.
Yes.
But what is well known in the main documented or the main trusted sites,
Yeah.
it is like main 1 it is 3 Bs.
Yeah.
This is
Yes,
what we
yes,
know. And the main 2, it is a
2
main
P.
2A and B. Both of
Okay.
them, the fixed medullary thyroid carcinoma plus
Mm.
pheochromocytoma in
Yeah.
both. The
yes,
last in
yes.
hyperparathyroidism in the A, and the other one,
Yeah.
marfanoid habitus and neuroma, mucosal neuroma in
Yeah.
the, yeah.
Okay, thank you, Dr. Mahjoub. Dr. Ahad commented, well done, Dr. Sally. I think the case wouldn't be typical in the exam. These or there should be distractors, but you will pick the closest differential according to the history, family history of thyroid cancer, and also past medical history of thyroid removal, plus some symptoms of phagocytoma and hypertension make men priority in differential. Yeah, I think, and men too, again, men too, it's not only men, you have to specify the men you are suspecting because it's
Okay,
totally different, okay?
okay.
Yeah, this is what I know. This figure we know it from Dr. Ragad shared it. This is we know it since the
Part two.
MRCP one,
College. Yeah.
part one.
Yeah,
Yes,
yeah.
yeah. This is what I know, and everyone knows. I don't know from where the source of your photo, but this is the figure
Yes,
we all
even me.
memorize.
Yes,
Yeah,
even me. My knowledge, like you. Uh, but when they put this and they say it is updated about main one. So yeah, now it is misleading for me when I have been
yeah. That's
tested
why
for
I
this
was
scenario
wondering. You
because
mentioned min
I'm
one.
get confused. Yes, yeah, I'm get confused
Anyway,
about.
in
Mhm.
exam in the exam they will give you classical history and the classical one. So they will give you min one or sorry min two with a history of removal of the thyroid. Even you can ask question, does it or was it cancer? Okay, she can say yes,
Yes.
there is, or it was a cancer. And the same for your mother, yes, it was a cancer. Okay, as you know, they are prophylactically removing the thyroid. Thyroidectomy here is
Yes.
prophylactic one, right?
Okay.
So you have to specify the question why they remove. You ask already, but be more specific. Was it cancer? Because you ask, do you know why they remove it? She told you, no, I don't know. You can ask her, was it a cancer? Then it will show the examiner that you are asking for men too. At the same time, if she said or if she answered wrongly, then you will show the examiner that you ask for the men, to be more specific for men too. Okay.
Yes.
Again, we need to improve the fluency only. Okay, Dr. Mahmoud, you can comment.
And I think in general, overall, Dr. Sari, what you did is good. But with more practice, you will be more better. Because now in this case, you took maybe around 13 minutes in history. 13 or 12 to 13 minutes. So the same, we will comment the same. And if you took this long time in history and still you will not master it, because here when I saw you are taking the history, I said, "Halas, this is you already catch the men." Because it's obvious, by the way, Dr. Kani, she's not misleading. She's so generous with you. I think because she's giving the history of medullary thyroid cancer, plus symptoms and signs of pheochromocytoma. The patient is hypertensive. He has sweating, palpitation, headache, and he has family history of thyroid disease, and it is already so obvious. And I think you catch it for some moment in the middle of the scenario. I think you catch it. But when you said in the differential or talking to the patient, you put the thyroxine number one. At that time, I know you're misleading that one. And as the Dr. Ahad comment in the comments, you will not find in the exam the typical scenario. And you will not find flushing, something like that. You will not find every details. But as long as you found the big hints like hypertensive, young patient, sweating, palpitation, headache, family history, history of thyroid surgery, whatever, medullary or something, at that time you will put the men in your mind. So I expect at that time you will look for the symptoms and signs of hypercalcemia, or in the examination you will look at the mouse to show the mucosal neuroma to differentiate even furthermore. This is men A or B, men A or B. But I think what you did with practice, you will be more better than this, especially in the time management. Because as long as you took a short time in history, you will find time to do examination and to think what might be going on. Just keep on.
Yes. Thank you.
Yeah, thank you, Dr. Mahjoub. A very valid comment. And I think she will get improved with the practice. I believe on that. One more point, if you want to be more specific for pheochromocytoma, Dr. Sally, you can say, or you can ask if the symptoms comes as episode. I think you asked this question, right? Is it episodic?
Yes.
Comes and goes.
Yes.
The
Yes.
sweating and headache. If
Yes. I
you
have
ask
asked.
this specific question and you get the answer as yes, so it's a straightforward for pheochromocytoma. In top
I
of
get
your
no.
differential as doctor.
I get the answer no.
Okay, it's okay.
She said to
The
me no.
differential, yes. Sorry, sorry.
She said to me no.
Really?
Yes.
Yes. I don't remember. Anyway,
Okay.
it's okay.
I said you
Maybe.
have attacks. It comes in attacks, sweating and palpitation. You have attacks, and she said to me no.
So
So
actually,
it's
in
okay.
this session, Dr. Asali, we are all learning from this. It is better to do
Yes.
mistake
Sure.
here. because
Yes,
if
yes,
you do if you did mistake, you will not forget this again. If you face that scenario in the future, you will not
yes,
forget.
sure.
But so that is good. And don't look at
It is,
the
yeah.
opposite side here.
Rather, yeah, sure, you are right. For me, it is better to be tricky, rather to be smooth and to be. For me, I will be more
Yes.
calm if it is going more smooth. I feel that now I'm fine. No need for more practice. But when I will stuck more, I will get upset. Then I will try to be more trained.
Yeah, it's good to be calm, Dr. Sam, but PACES exam is calm and fast and fluent. Okay, calm means control the stress, but don't be slow in the question manner.
Okay.
Dr. Kani and Dr. Yeah, I think also someone wrote the word episodic, it's important. Yes, as I said, so you have to be more specific. You will get improved with the practice, Dr. Saeed. Thank you, Dr. Sally and Dr. Kani. Thank you, Dr. Mahjoub,
Thank
for
you
your
very
valid
much.
comments as usual, Dr.
Okay.
Thank you, everyone, for the attendance today. See you, inshallah, tomorrow, the communication day.
Thank you, Dr. Sally.
Good
I'm
luck and
sorry if I misled you.
Thank you.
Thank you very much.
No, no,
Thank you for your
no.
comments.
I just
Yes,
no. I
thank
will
you.
say to you, thank you. I will not forget, and
Yes.
especially you fixed for me the knowledge about the thyroid associated. It was a big and fatal mistake, as Dr. Basim said, because took this in my mind because they said to me it is the update for main one, and even I'm carrying this point in my corner of my head because I'm afraid that to be updated even in basis. So if this came in the exam, so I will fail
Yeah.
because of this mistake.
Dr. Akani, by the way, you heard Dr. Basim, he said squeeze her, you squeeze her more in the last
Yeah.
3 minutes you squeeze more than and actually and to be honest,
Fortunately, she
this
asked
is
her
the
this
most
question.
and the
Really,
most
yeah.
important question you ask her during the squeeze time, 3 times, 3 minutes.
Thank you, Dr. Aha. Thank you, Dr. Basim. Thank you
Okay,
so much. Thank you, Sally. Thank you. Bye-bye.
okay, welcome.
Thank you, everyone. See you tomorrow, inshallah, the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Excellent.